All right, so welcome to Balanced Flow.
Thank you.
We're so happy to have you. And I know you come with experience in hormones and peptides and stuff like that. I love talking a lot about testosterone. And so I love to see from outside experience from our clinic, outside of our clinic at Balanced Flow, what have you seen in benefits for testosterone, like cases and changed lives and inspirational stuff like that? What have you seen?
Relationships and marriages being saved, post-op recovery from surgery patients, athletes, to our 80-year-old patients that just want to garden and be able to move around and have better quality of life. I mean, amazing benefits. Increased muscle mass in women, libido, osteoporosis prevention, all the things.
Cool. Are there any like specific cases that like really stand out to you? Like maybe give me like a man and a woman that like you were just like wowed by and it was very memorable. Like what?
Yeah, I would honestly say optimizing couples is one of my favorite things. So a lot of times when you're introducing, you'll have a female patient come in and she complains of, gosh, I have brain fog, fatigue, weight gain. I don't know where this is coming from in that perimenopause kind of era of life. And then we look at those hormones and we start optimizing them and increasing those levels, getting that thyroid working again, along with testosterone. Then the husband comes in because it's like, gosh, my wife she's got vitality and, we have a better sex life now and I can't keep up.
It's like, what's going on?
Right.
That's funny.
Yeah.
We've actually seen the opposite. Because a lot of times we start with a man and then their libido goes up and then they're like, you gotta get my wife because she's not
right
into it. Yeah, we've had the same marriage thing is a pretty common.
Or, I guess I would say maybe a little bit more specialized women my age. So women in their 30s, a lot of us were on control for a long time and you don't know what you don't know. And not knowing that, sometimes the long-term effects of birth control, you're depleting bone health, joint health, you're having increased issues with brain fog, muscle mass, decreased libido. And then having a provider that understands that and can help optimize you and testosterone support is a great option. So kind of brings you back to life again.
Yeah. Are you surprised, and we've always been surprised, like in your past experiences, are you surprised like how many people are either miseducated or don't realize like what hormones can do for you or don't even realize that's an option?
Yeah, a lot of times a common comment that we get is, well, I don't do testosterone because, I don't believe in steroids or I don't want something like that in my body. And so kind of educating patients on what the differences are.
Yeah.
And also synthetic versus bioidentical hormones and how they can help.
Yeah. Okay. So you've seen a lot of like, they just think it's like the same thing as anabolic steroids.
Exactly. Or being told the most common I think that we get is that they cause cancer. So that's an interesting conversation to have.
Yeah, I was just having a conversation with a gentleman last night. He's an acquaintance of mine, and I got to have a good conversation. And he's like, oh yeah, you know what? I was on testosterone for a year, but then I stopped taking it because I had a blood clot in my calf. And I was like, perfect opportunity. I was like, they literally just lifted the black box label on testosterone, finally looked at their actual research and said there's actually no correlation or cause like linked to testosterone causing any blood clots or heart attacks, And like I talked to him a little more and it was like, oh yeah, like the previous day I had a really hard leg and calf workout and then I sat on a plane for several hours and then I got a blood clot. And I'm like, okay, well, you were taking the testosterone, but I don't think that's what was causing it,
Yeah.
So there's a lot of stories like that can invoke a lot of fear in people, but like the research is very clear that there is no link to blood clots, heart attacks. So clear that they finally said, this is not even a warning anymore. So,
yeah. And that we know that a lot of times testosterone or hormone therapy is protective for the heart and helps to prevent some of these things. So.
Yes, I was just telling them about that too. What have you ever had any stories about that or like anecdotes like as far as heart health and cardiovascular health?
I would just say, I've worked with older patients. So for them, especially kind of what I talked about before, like your grandmother that's 80 years old, she's not really looking to have an active sex life. That's not her goal. Her goal is to be able to garden, or her goal is to not have heart attacks or heart disease like her family experienced. So we've seen a lot of that, or we've seen patients who are on blood thinners, who have had open heart surgery, started optimization therapy, were feeling better, eating better, taking better care of themselves, went back for their blood work, and
heart's much better, right?
Much better.
I've seen that too.
So.
I've seen like cholesterol like
Yes.
really dive down. People are like amazing, like dropping like 70 points cholesterol over a few months, and it's like wow. And their doctors are like, "What are you doing?" And we're like, what you should have done.
Right.
But no one knows. I'm not blaming anyone. But
right.
It's just like people don't know, you know.
Yeah.
And it's just amazing that we can do these things for people. Like, cool. I mean, well, thank you for chatting.
Thank you, Doctor.
Any other thoughts? Like inspirations, motivations that you can offer people?
I would just say be curious. If you're not sure, if there's something going on and you feel like your doctor's not answering you, or we talk about medical gaslighting, or you don't have a primary care, seek out places like Balance Flow. And we'd be happy to talk to you about it. I'd be happy to talk with patients, my own experience. But I think it's important because we want to prevent disease. We want to be healthy. So.